Well, good afternoon, and to all of you here today, thank you for being with us, and to those that are viewing from elsewhere, welcome. Today I want to talk about our COVID cases, the new mitigation measures that began on Sunday night, as well as the upcoming holiday, and then we'll discuss some legislative actions. First, let's start with some good news. In the past couple of weeks, two major pharmaceutical companies, Pfizer and Moderna, have announced that the COVID vaccines they are developing are very promising. Both appear to be close to 95% effective in clinical trials and could be ready to start rolling out by the end of this year. We have been planning for distribution for months, and we will be ready. This is wonderful news. It gives all of us hope. It means a light at the end of this tunnel, and I think we can all agree that this has been a long tunnel. As a doctor, I have to caution everyone that light is a few months away still. These vaccines will take time to distribute. Until then, we all need to keep taking precautions. But we all need something to feel hopeful about and to look forward to, and the vaccine news is very promising. Another piece of good news is that while this virus is spreading in Virginia, we remain near the bottom of states for the rate of new cases, and this is good news. So let's look at this chart from the New York Times. And it's kind of a busy chart, but this is ranking of states with cases going up. You'll see we're fourth from the lowest. The only places doing better than Virginia are the islands or extremely cold rural states. So this news is good for Virginia because, as you have probably seen on the national news, the COVID pandemic is surging across our nation. Case counts, hospitalizations, and deaths are rising dramatically. We do not want to see the situation here in Virginia get worse. So while we're doing well compared to other states, we are also seeing greater spread of this virus. We recorded 2,071 new cases yesterday and 25 additional deaths. The day prior, there were 29 deaths reported. We're seeing a record number of daily cases recorded this week. As you can see on this slide, we are doing thousands of tests a day. Our percent positivity has tipped just past 7% this week. Just a few weeks ago, it was 5%. The most rapid and concerning spread remains in the Southwest region, but all of our regions are seeing increases. And you can see that hospitalizations are going up. I do not intend to wait for things to get worse before taking action. That is why we have put new mitigation measures in place to help slow the spread of this virus. These mitigation measures apply statewide because we need them in every region. We don't want to wait until we're seeing overwhelmed hospitals and double-digit positivity rates in every region. Social gatherings must be 25 people or fewer. And I emphasize fewer because this isn't a floor, it is a ceiling. I strongly discourage Virginians from having social events with that many people, especially indoors. It's just too dangerous, and you increase the risk of spreading this disease. We know that one factor in the increased spread is small gatherings in people's homes. I know this is really hard with Thanksgiving coming up, but that isn't the best idea. While socializing virtually is the safest way right now, if you must get together with people outside your household, do it outside if you can. Under the new rules, restaurants must stop serving alcohol at 10 p.m. and close their dining rooms at midnight. While the virus can certainly spread at restaurants before 10, We know that the later the event gets, the more likely people are to drink and forget about social distancing. Children age 5 and up are now required to wear face coverings in public, including in our schools. This aligns with recent CDC guidance. Virginia has had a mask requirement since May, and we all need to remember that. The science shows us that wearing masks reduces the spread of the virus and can protect the person wearing the mask. This is such an easy thing we can do to help care for other people, so please wear a mask. We are strengthening enforcement of existing statewide guidelines. Businesses must follow the guidelines for physical distancing, face coverings, and enhanced cleaning. For some establishments, these had been a best practice. Now violations will be enforceable through the Virginia Department of Health. Spectators at recreational sporting events will be limited, as will entertainment venues and racetracks. Other states are implementing similar measures. Yesterday, the Navy put limits on travel and activities for sailors in the Mid-Atlantic region, including those right here in Hampton Roads. We know that these measures work. Back during the summer, when cases surged in Hampton Roads, we implemented similar mitigation measures there, and we saw case counts go back down. It can work again, but we all need to follow the rules. I know that everyone is tired of this pandemic. We've been doing this now for 8 months, and it is stressful and it is exhausting on all of us. But you have done a great job, Virginia. We have some of the lowest rates in the nation, and that is because of each and every Virginian who wears a mask, who stays at home, who understands that this is about our responsibilities to one another. A vaccine is in sight, and while that will take time to distribute and take effect, I hope that just a few months from now we may be past the worst of this. So let's not make this winter any worse than it has to be. Be smart, be careful, and think of those around you. Now I'd like to turn to our state budget. The General Assembly recently ended its special session and sent me a budget bill. Today, I have signed that budget. I think it's a great budget for Virginia. It is very progressive, and it includes provisions to protect Virginians from evictions and utility shutoffs. We continue to take further actions to support our frontline workers and protect taxpayer dollars. Earlier this year, the federal government authorized Title 32 status for the National Guard, which meant the federal government is paying for this assistance. This week, I have asked the federal government to please extend our Title 32 status through next year at 100% of the funding. Throughout this pandemic, our Virginia National Guard has been a critical partner, helping move supplies and especially helping provide manpower and logistics for testing events. So on behalf of Virginia, I thank and I encourage you, if you get the opportunity, to thank these men and women who are right now serving our Commonwealth and serving this country. I want to turn now to our small businesses, like restaurants, fitness businesses, and local stores. I've said many times, we have both a health crisis and an economic crisis, and we are focused on both of them. I know our small businesses continue to struggle and face very real, very difficult pressures. You don't know when customers will come back. You struggle to keep your employees safe, and you don't know what is going to happen or when all of this is going to be over. So I know it's impossible to plan for the future. We are working to provide some support and assistance to businesses through the Rebuild Virginia plan. A few weeks ago, we expanded the eligibility for this grant program and put additional money into it. I'm pleased to say that this funding is going to go out the door to help businesses. We've received nearly 15,000 applications and so far have approved more than $55 million in grant payments. Almost 39% of that has gone to businesses in low-income communities. But I know that everyone from laid-off workers to businesses continues to struggle. We are encouraging Congress to pass another stimulus package. I've been in touch with members of our congressional delegation just this week about this. Now that the election is behind us, and I think everybody is pleased about that it's behind us, Congress needs to come together to get this done, and they need to get it done now. The sooner, the better. Finally, as we get into colder weather, I want to remind everyone to get a flu shot. It's a simple and easy way to protect yourself and those around you. We don't want you or our hospitals dealing with the flu while also fighting COVID. I'd also urge Virginians to please donate blood if you can. The Red Cross is always in need of blood donations, and it has not been able to conduct some of the large blood drives it typically relies on. You can find out more at redcross.org. Today, we are 9 days from Thanksgiving. And while 2020 has been a very tough and challenging year, and those challenges are not over, we can be grateful for where we are and how far we have come together. But I ask you, Virginia, to think hard about how you celebrate this holiday. Consider the risk, not just to yourself, but to your family and to your loved ones. We all want to be together to have our traditions, to celebrate something with people that we deeply care about. I know there have been few enough celebrations this year. We think of Thanksgiving as a time of family and of love, and maybe some football. But this year, staying home is an act of love too. Protecting the people you care about, protecting your neighbors and community, even protecting strangers is an act of love. So please think about your holiday plans and the risk. Eat outside if you can. Have a smaller gathering. Hold a virtual Thanksgiving. Zoom is making it easier for people to get online for Thanksgiving by lifting its time limits for this purpose, and that's great. Do your Black Friday shopping online. College students need to be very careful and thoughtful about how and whether to go home for the holiday. Follow your institution's guidance. Be kind, please, to the retail workers, the grocery workers, the essential staff, and especially our healthcare workers. If you feel sick, please stay home. If you think you need a test, get a test, and stay home while you wait for the results. And do what we all know works. You've heard me say this a number of times. Please wash your hands, wear a mask, avoid large gatherings, and download COVIDwise, our health department's app that will notify you if you've potentially been exposed to someone who tested positive. So let's all act together to make sure that next year, everybody that we love is at that Thanksgiving table. Now I'll turn it over to our Virginia Health Commissioner, Dr. Norm Oliver, and then we will be glad to take your questions. Thank you. Dr. Oliver.
Thank you, Governor. Good afternoon. As the Governor mentioned, cases that were reported yesterday are 2,071. Cases have been increasing steadily over the last period. You saw that graph in the Governor's presentation. Our case incidence rate was about a month ago around 9 cases per 100,000 population. We're now double that. We're approaching 20 cases per 100,000. The total number of cases have hit 208,833. The governor mentioned that we had 25 deaths reported yesterday, and that brings the total death count to 3,860 people. We have been doing quite a lot of testing. Our average testing is around 20,000 tests per day. We have a total now of 3,229,178 PCR tests. Yesterday, we posted another 20,273 tests. I think I'll leave it at that. The governor made, I think, quite a impassioned and very on-point remarks regarding what we need to do to get a handle on stopping the spread of COVID-19, and I hope everyone takes his words seriously.
Governor, could you walk us through enforcement on the change to the social gathering and what direction you're giving to law enforcement about how to enforce that and when they do step in?
Henry, the question is enforcement, and I would say that we are stepping up our enforcement, but the majority of businesses across Virginia are really following the guidelines and they're doing the right thing. But the health department has ways of enforcement. The ABC, law enforcement agencies across Virginia all have that availability. And so we, as you know, introduced and passed legislation to have a civil penalty rather than a Class 1 misdemeanor. That doesn't go into effect until March. So between now and March, if there needs to be enforcement, it will be done through a misdemeanor. And I would just encourage Virginians to do the right thing. What we're asking to do is not a lot, and that is to wear masks and keep our distance and abide by the limitations of people in different venues. And as long as people do that, as long as they're part of the solution, then we don't have to worry about enforcement. If we do, Henry, that option is there.
And for home gatherings, is there a direction about how to handle those specific ones?
Well, obviously those, are difficult to enforce, but, I would just say that if someone is not following the guidelines and law enforcement becomes aware of it, they may intervene.
Hi, good afternoon. I'm curious, at your last briefing early last week, you didn't make any mention of any restrictions, and then Friday, of course, we get the announcement that they're going to take effect Sunday. I'm hoping you could walk us through kind of what happened between those days that led to you changing course. Was it the fact that other states were imposing these restrictions? Just kind of hoping to understand the process a little more.
Sure. Thank you for the question. And the question is about the decision-making, why we decided Friday morning. I meet every day, either in person with our healthcare team, Secretary Carey, Dr. Oliver, Commissioner of Health. We look at the data. We look at where the spread is, where the hot spots in Virginia are. We talk to our tracers, where the cases are occurring throughout Virginia. And so that's a daily process. I actually asked for a meeting on Friday morning to go over the data, statewide positivity rates, incident rates, and listening to that data Friday morning, and then also just knowing of the spread that we're seeing in Virginia, seeing across this country. And really, I will tell you, you asked the question, I'll tell you what really affected me is seeing mobile morgues outside of hospitals because there's no place to put the dead. We don't need that to happen in Virginia. And so I follow the data every day. I made that decision Friday morning. We made the announcement. I wanted to make sure that Virginia knew what we were going to do, that they would have a couple of days to prepare. This went into effect Monday morning at 12:01. An EO was put out later that afternoon, and here we are. So all options are on the table. We will continue to follow the data. As you know, we have Thanksgiving coming up. We have the flu season coming up. If Virginians will do the right thing, and by the way, this is in your hands, Virginia. You know what to do. And if we do the right thing, We will keep those numbers down. We'll keep the curve flat, and we'll be able to move forward and await anxiously the vaccination, and as soon as we can get back to near normal. Alan.
Do you have a figure on, in terms of schools closing or pausing their reopening? Dr. Oliver's mentioned it went from 9 to 18 and out of 100,000. Is there a number that if we got to, you would order all schools closed, or on the trajectory we're on, what's going to happen with schools?
Alan, it's a great question, and as we have said before, we have a diverse Commonwealth, no one size fits all, and this is why I made the decision earlier to give, I think, very consistent guidelines to our school districts. We have the dashboard that I know everybody is aware of, but then allow the localities to make those decisions, because what may be good for one area of Virginia is not necessarily good for another, so I've given them that discretion. I don't have any numbers in mind, and when I'll intervene, I'm going to continue to let the school districts, the localities make those decisions. Jackie.
Yeah, we've seen a number of states put in travel advisories, everything
Yes.
from saying cancel your trips, as advisor, even mandating testing or quarantining. So why haven't we seen anything come out of Virginia? Is this something that you're considering at all?
Again, Jackie, all options are on the table. The guidelines that we've put in place, we feel that they'll work. They have worked in the past for us. And again, I hope everybody listening, everybody that will read, everybody that will watch your broadcast will realize this is in Virginia's hands right now. And, right now, if you look at our numbers, our positivity rate is fairly low compared to other states. Our incidence level is 4th from the bottom, which is good. That's where we want to be. And so as long as we continue to see those kind of numbers, we'll continue with our guidelines.
Drew Wilder, NBC4.
Thank you. Governor, you already touched on part of my question as it relates to schools throughout the Commonwealth, but I want to step back a little bit and ask you a question. Throughout this pandemic, especially early on, you were very critical of the president's administration for not imposing stricter national guidelines, saying that could have been one of the reasons, likely was one of the reasons why the virus was spreading. Given that you were critical of the administration for not doing something broadly there, why aren't you doing something throughout the Commonwealth as it relates to schools? What's the difference between the approach that administration took and what your administration is taking handling schools?
Well, I think we have given very consistent guidelines to the schools. We have a dashboard. They have access to all of the data that we have, and again, one size doesn't fit all. I've allowed the localities to make those decisions, and that's the way we'll move forward.
Governor, back to the new restrictions in place, how did you reach specifically the 25 number for the gatherings? Because I believe anecdotally, Dr. Carey was talking about you're seeing even smaller gatherings in Southwest Virginia leading to the spike in numbers, so why not go lower? And then just the logic or logistics or the science behind dropping the mask order from 10 to 5.
Yeah, okay, thanks, Cam. As far as 25, there obviously, if you look at the data, and we could actually supply that for you later if you're interested, the instance or the chances of getting infected, the larger the crowds, the higher the risk. And so we've looked at gatherings of 250, looked at gatherings of 100, looked at gatherings 50, 25, 10. Obviously, if there are no gatherings, that would be the ultimate low risk. And so, we chose 25. Again, looking at the data, we thought that would be a good starting place. But Cam, I think to your question, and as I made this clear earlier, all options are on the table. And I watch the data, I look at the data every day, and if we see that 25 is not getting us where we need to be, we'll obviously make adjustments. But that's the number that we came up with. The other question is about masks. And, as a pediatrician, I've always seen that children are very impressionable, number one, and also they can follow guidelines well. And we did have the mask age at 10, but I've actually visited, as has my wife, some of the K through 12 schools, and even early childhood, prior to kindergarten. And I've seen the children with their cute little mask on. They want to be part of the solution. And so, just to protect everybody, to protect them and protect their families, we chose to change to age 5. And we think that they'll accommodate that quite well.
ABC 13.
Hi, Governor. Pivot for a second. I wanted to talk with you briefly about your marijuana legislation proposal and whether or not that would have any kind of impact on people who have been previously convicted of any marijuana charges. Would that have any impact, or is that just a moving forward type legislation that you proposed?
It's a great question, and part of the reason for moving forward, we obviously decriminalized marijuana last year. We think that Virginia is in a position now where we're ready to move forward with legalization, and it is an equity issue. I think that's what some of your question was referring to. So, as we move forward, we will look at ways of expunging. That's obviously going to be a topic of discussion in the upcoming session. Also, restoration of rights will be important. So, anybody that has been hurt in the past, adversely affected with their record, with a conviction of marijuana use, or we'll look at that and do everything that we can to clear their record and allow them to move forward.
COVID-19 vaccine is, appearing increasingly imminent. I know VDH has estimated they'll need $120 million for the statewide vaccination campaign, and right now we've seen $22 million in CARES Act allocations towards it. And so, what is your plan for funding that effort if Congress does not pass another stimulus bill?
Yes, a good question. So, I think, Kate, your question is, how do we pay for this? And I think there is so much excitement and enthusiasm. Obviously, we have put money into our budget to prepare. To your point, it's not as much as we need. But I anticipate everybody is so anxious, when I say everybody, this country and the new leadership, that I think that the President and elect and Congress will work with us and make sure that we have all the resources that we need to deploy, distribute this vaccination, and to get this pandemic behind us. I don't see that as being an issue. And certainly, we have funds in Virginia. We're going to be back in session in January. I just signed the budget today. We're already working on the next budget. Our revenue right now is good. It's very promising in Virginia. So I hope and I suspect that the federal government will be there to help, but we'll be in a position statewide to have the resources necessary to keep Virginians healthy.
Tracy Agnew, Suffolk News Herald. All right, next we'll go to Carrie Pugh, Inside Nova.
Hi, Governor. Can you tell us, is there any preliminary timeline for a vaccine rollout in Virginia? Just an idea of the soonest that Virginians might see this vaccine?
Do you all want to review just high level how we're going to deploy this? Yeah, but we're looking, I have Dr. Oliver come up. I listen to the same information you do. Also am privy to our weekly calls that the governors receive. And I think looking at the way things are evolving, that a vaccination will be available toward the middle or latter part of December. And certainly people at high risk will receive that, and then we'll go from there. But I'm going to let Dr. Oliver give a little bit more detail. Thanks, Dr. Oliver.
Thank you, Governor. As the Governor said, we suspect that we will have vaccine by the middle of December. We've had discussions with General Perna, who is heading up Operation Warp Speed for Health and Human Services in Washington, D.C., and the federal government. With General Perna's team, we have been working on logistics for the delivery of the vaccine. We've located 14 sites already in the Commonwealth for ultra-cold storage. The Pfizer vaccine requires storage at minus 80 degrees centigrade. We've identified places across the Commonwealth for storing those vaccines. The Moderna vaccine requires normal cold chain at about 20 degrees centigrade. That's much easier to deal with, and we are prepared to handle that as well. The initial deliveries of these vaccines would be aimed at the healthcare workforce, and there will be limited quantities of this vaccine initially. And we will be working with our partners in healthcare systems and first responders so that they can get vaccinated in what we term closed pods of dispensing, closed places for dispensing. So if we send vaccines to a hospital, the hospital itself would then be charged with carrying out the vaccination of their workforce. By the turn of the new year, we expect that the vaccines that are available will then their production will increase so that we can finish this phase of covering all of the healthcare workforce and first responders, critical workforce in critical industries. And then as the production ramps up in the early months of the new year, both with the vaccines that will happen towards the end of this year and with other vaccines. You got to remember there's a good 6 or 7 other ones that are pretty close to coming on board. We will enter a new phase in which we can start doing mass vaccination. And all of these things we're quite prepared for, have a very detailed, granular plan for how to deal with this, and are really excited about launching into it. So that's where it stands. I should say that the FDA has a very rigorous process for vetting vaccines. A clinical trial of 30,000 is those of us who've been in medicine, we know that that's a pretty extensive clinical trial. That evidence will be looked at by the FDA. The emergency utilization authorizations, the EUAs, will not be given to any vaccine that the FDA does not consider to be safe and effective. The CDC's ACIP, the committee that reviews these things and gives recommendations on vaccinations, will review that. So that process will go through on all the vaccines, and when we get one here in Virginia, even the one that we hope to get in December, we can be assured that it will be safe and effective, and we look forward to being able to carry out that campaign.
You kind of touched on this already a little bit, and from the caller who talked about wondering if you have more restrictions on one hand, and then on the other hand, there's a school of thought of people who say, well, we should continue to wear a mask, distance each other, if you will, and let the chips fall where they may, quote unquote, not my quote, but a caller's quote. You seem to get a little emotional about some of the deaths that you are seeing. Just kind of speak to that school of thought of people who say, let the chips fall where they may. And then on sidebar, you've recently added personnel to your diversity and equity department.
Yes.
What does this additional help do for people of color who, as you know, are affected greatly by COVID-19?
Well, Andre, it's good to see you, number one. And I know you're smiling under your mask. As far as letting the chips fall, that's despicable for someone who ever said that to make a statement like that. And I would just go back, Andre, to the comment I made about the mobile morgues. We should all find that as unacceptable. We never want to get to that position. We don't want anybody to die from COVID-19 in Virginia. That would be our goal. And I would also, just as a doctor who has spent a lot of time in hospitals, I think anybody in the healthcare profession knows what I mean when I say the respiratory season. That's usually 2 to 3 months. It is a very, very demanding time of the year where healthcare providers have to gown up. They have to use PPE. That's what they stay in day to day. And I'm in contact with these people, Andre, because that's my business. That was my life before I became governor. And they're tired. They're fatigued. They're seeing people die, and it's tough. And we don't want to go down that path any farther than we have to. And so we're going to do everything that we can, and that's why I've done and our team has done to keep Virginians safe, and we'll continue to have that as our top priority. You mentioned Dr. Janice Underwood, who is maybe here. Yes, Janice, welcome. Janice is the first Diversity, Equity, and Inclusion Officer in the United States. She has a cabinet-level position. She started in June a year ago. She literally hit the ground running. She's done an amazing job, not only for our administration, but she's reached out to agencies, to colleges and universities, to communities. She leads the health equity team that's making sure that we have PPE and hand sanitizers and testing out in the communities. And there's not so much that one person can do, right, Dr. Underwood? And so we have expanded her staff. And actually, if you'd like to come share with us about your staff and what you're doing and how we're moving forward, welcome, Dr. Underwood.
Thank you, Governor, and thank you for the question, Andre. The Governor's Office of Diversity, Equity, and Inclusion has expanded. It really does underscore the Governor's commitment and the Northam administration's commitment to really dealing with equity issues across all secretaries, which also includes the public health issue and crisis that we're dealing with today. We know that there's a disparate impact on COVID-19 and a overburdening of communities of color and low-income communities with COVID-19. And so this all-star dream team is what I'm calling them, has been assembled, and we're really going to link arms with all the secretariats to intentionally think about equity principles across all areas and sectors, both public and private. But I just want to give a quick shout out that Alacia Black-Hackett will serve as my Deputy Chief Diversity Officer as the lead deputy. Mona Siddiqui will serve as the Deputy and Senior Policy Advisor in charge of immigration reform and refugee reform. And Yawande Austin will serve as my special advisor to the Chief Diversity Officer. And of course, we have Michaela Swan as the Executive Administrator. This all-star dream team is really working in concert together with me across the Commonwealth, as the Governor mentioned, to really think about equity across the sectors like institutions of higher ed, state agencies more broadly, but also we want to create a coalition of allies across other states. We want to make sure this position that the Governor took leadership on is in every state and every governor's cabinet. We want to be the case study for the nation, a nation that's reckoning right now with issues of reconciliation and how do we get back to a place where we know that diversity is our biggest strength, our largest asset. These are humanity issues, and so really excited to lead this work. And thank you, Governor, for your leadership.
We're going to do one more on the phone and then one more in the room. Do we have Max Thornberry with the Northern Virginia Daily? No? Okay. Well, then we'll go to Luann Rife with the Roanoke Times.
Good afternoon, Governor. I was wondering, could you talk a little bit about whether you've been in discussions with Ballot Health and their really pressing need for healthcare workers? They have a couple hundred at a time out that are in isolation or quarantine, and, you know, the system is really stressed. Also, if you don't mind, a second question, I was wondering if you were considering any travel restriction bans.
I'll answer the second question. I'm going to let Dr. Carey talk about Ballot Health, but the guidelines that are in place right now is the way we'll move forward from today. Obviously, it's, I've said we follow the data every day. If we need to talk about other measures to mitigate this virus, we will. So, Doctor, and if you want to mention that talk about it if you need to.
Thank you, Governor. Yes, we have been in close contact with the team at Ballot Health. I try to check in with them because they're in the area of Virginia the last 4 to 6 weeks that have the highest incidence rates. So talking to Alan Levine, the CEO of Ballot, understanding what's going on both in northeastern Tennessee as well as across the border into southwest Virginia, you're exactly right in that I think we've mentioned in previous press conferences that the issue is not beds. The issue is not right now PPE. We'll keep our fingers crossed going through the winter months. It is staff. And in the past, we've had great response from the Virginia Medical Reserve Corps. Thousands of folks have signed up, and they've staffed testing events, community outreach events. They staff polling places to keep folks safe. And they can certainly help somewhat in that setting, but what we're talking about frontline ICU nurses, ICU respiratory therapists, and ER nurses in particular, that they're having the greatest challenges. And in other natural or national disasters, we could borrow from one area to take it to another area. But as you've seen, cases are increasing all across Virginia. So our first thing is to check in with them to see if there are elements of the Medical Reserve Corps that can help. Are there other logistical supplies that we can help? But the issue really is that there's a shortage, and that there's a shortage in all parts of the country. So what we've been discussing, and this is with Commissioner Oliver and the Virginia Hospital and Healthcare Association, are there times when they need to transport their patients towards up I-81 or other areas that may not be as severely affected? That won't necessarily stay the same through as we enter the months as the pandemic changes throughout Virginia, but that's certainly something that we're investigating along with Virginia Department of Emergency Management. Logistically, that would be a last resort, though, moving patients outside of their home regions. That's where we want to keep patients. So we're exploring with them, again, logistical support. Is there training that we can offer? But as Alan Levine, the CEO, mentioned to me, he said, Dan, your messaging to all areas of Virginia, especially in Southwest Virginia, the importance of hand hygiene, wearing a mask when you're going into stores, the new restrictions that the governor has imposed. It's really encouraging. The biggest help we can provide to their health system is encouraging the population to follow the guidelines that we know work and reduce spread of the virus in Virginia. So I think it's important to keep that in mind, and that remains our most powerful tool.
Yeah, I'm curious because you guys have a number of times now mentioned that you are sort of following the playbook that worked in Hampton Roads. But I believe at that time you also reduced indoor restaurant capacity. So I'm just wondering, why did you choose to take certain pieces of that and not go as far as to reduce the indoor restaurant capacity right now?
The question is about restaurant capacity, and restaurants are already at a reduced capacity, Jackie. I mean, they have to keep distancing. They've spaced their tables, so effectively they're already there. As you know, other states have completely shut down restaurants to indoor dining, and we haven't taken that measure. But again, just to say that I've said this a few times today already, but we follow the data every day, and all options are on the table. But right now we're going to move forward with these. That's what worked last time. I'm convinced it'll work this time, and I'm also convinced that there is hope. As I said, there's light at the end of the tunnel. I think we can all sense that. And we just need to, for the next couple months, just do the right thing and follow these guidelines. And, the less measures that we have to take to mitigate this, the better. Because, as I've said all along, we want our children to be back in school. We want our businesses to be back open. We want people to be able to go into our restaurants, and just like we were before COVID-19. And so if we continue to follow the guidelines, we'll get there with the help of the vaccination. So thank you all for being here. I really encourage all of you to continue to do the things that we know work, and also just have as peaceful and restful and safe Thanksgiving. as you possibly can. And we're proud that we live in the best state and the best country in the world, so let's keep it that way, and hope to see you all in the near future. Thank you.